Good afternoon. I'm Elizabeth Hess. This is our 11th week of COVID-19 updates with Julie Pryde, the administrator of the Champaign-Urbana Public Health District. First of all, I would like to thank Urbana Mayor Diane Marlin for letting us continue to do these series, as well as UPTV and Jason Liggett. Thank you for putting together this feed. Good afternoon, Julie.
Good afternoon. How are you doing?
I'm doing okay. I mean, we're 2 months in now, I believe. The last time that life was normal was March 11th, if I remember. Is that correct?
Mine was in January, but...
Okay. All right. So thanks for the planning. Where are we right now in Champaign County with the numbers? Are they going up or down from last week?
Well, they're going up. We are actually chasing down quite a few outbreaks. An outbreak is 2 or more cases. So we have the one up in Rantoul Foods, which you've all heard about, I'm sure. So right now we're at 266 cases. We have 114 of them that are still in isolation or quarantine. 7 right now are hospitalized, and we still have the 6 deaths. That hasn't gone up, thankfully. And to date, there have been 5,128 tests done in Champaign County. If you look today on the website this afternoon, you will find that the numbers are going to go up a great deal. We are now working 27 cases that were tested this weekend by OSF and SafeWorks up at Rantoul Foods. So we should see a significant increase in cases today. In general, though, and this isn't important for people to know because it might not seem like it, but in general, our community is doing pretty well. The hospital capacity is great. We have not been seeing increases in hospitalizations. And so while there are a lot of sick people right now, we still have a lot of hospital capacity. So that's kind of the goal with that.
So as you mentioned, there was an outbreak at the plant in Rantoul. Mm-hmm. Some of those positions, it is impossible to socially distance. If people have to go to work, how are they able to do this safely and keep their families safe when they get home?
Well, the main thing is the personal protective equipment. There are all kinds of ways put out there for infection control that everyone from the CDC, Illinois Department of Public Health, USDA put out there to try to separate people while they're on the line processing the food. That can be plexiglass shields between people, and again, everyone masking, and the everyone masking is really key. And then to use, hand washing when you're out and not crowd into restrooms or other common areas. So don't just wear your mask when you're on the line, also wear it when you are in the break room or going out for lunch or any other type of thing, and remain 6 feet from people during those times when that is possible.
Obviously, we're still talking about masks, and not everybody is still taking it seriously. Why are masks going to be what saves us from spiking even further, and why are people so resistant to wearing them still?
Well, the masks are really critical. We're now to the point of the pandemic and moving forward that all we have are what's called non-pharmaceutical interventions. So that is we've got now, the shutdown or closing places. But as we move out of that, and everyone wants to move out of that, there are ways to do that are going to prevent us from having to go back and do it all over again. Those things are really simple things, but people don't understand the importance of them. Number 1 is wear a mask anytime you're out and around people. At our agency, for example, we've been operating all the way through this with full staff and still providing services, and although some limited services, and we are still, we're all in the EOC, but we wear masks all the time. So anytime we are in a room with someone else where we cannot maintain, and we do a little more than 6 feet just because we're able to, but if you can't do that, have your mask on. So if I'm sitting at my workstation, I don't have to have my mask on, but if I stand up, the mask goes on, and for me to move around the building or even move around the room where everyone is. So that is key. The other thing is social distancing, and we're going to need to do that moving forward. Even as things open up, they will be opened up in a way that limits crowding. There is no crowding in the foreseeable future that I can, until we have a vaccine, where we can, like concerts, sporting events, things like that, where people are, packed into bleachers or stadiums, or even concerts, or even large religious services, anything like that, because that is going to give the virus, an opportunity to just spread wildly. And then the last thing is just the thorough and frequent hand washing, way more hand washing than you've ever done in your life. And it will, again, it will make the difference. And as we move through this, a lot of people are becoming much more comfortable with it. And I don't know why people wouldn't not wear a mask to protect someone. There's everything from, the fake science or the science denying out there. But there are people who legitimately cannot wear a mask because of a health condition. But other than that, you're really wearing it to protect your community, to protect everyone's health. So it is important. But I will say that I was out this weekend at a store. I had to go pick up something for a older friend. And when I was in there, I bet you I saw one person in the entire store that did not have a mask on. And people were really respecting social distancing. And I've been in that store many times for her, and it's usually packed. And, this time it was just very, very well run, and everyone except for one person had a mask on. So I found that very, very encouraging.
That's great to hear. People love a good marketing campaign, a slogan, something to remember. Tell me a little bit about Wear It, Don't Share It.
Well, Wear It, Don't Share It is a campaign that is put together from the EOC, and the city of Champaign had a lot to do with putting this together as well in the Joint Information Center. It's called Wear It, Don't Share It. It's designed to give our community's diverse audiences a sense of power that they're taking action, helping out, and making a contribution during this unprecedented and uncertain time. Just by wearing a mask or a cloth face covering, you're doing your part to help protect our community. So the campaign is really nicely done, I think. And it's look for it around town. You'll see it on billboards and in social media posters, reminding people why it is important to wear the masks. And I think that I think it's a really good campaign. I would love to take credit for it, but it had nothing whatsoever to do with me, other than I very much support it. But it talks about when to wear your mask, when you're grocery shopping, or starting your shift, doctor's appointment, getting takeout, making a delivery, anyone over the age of 2, and when you can't be 6 feet away from people. And I think that if our community, and I've said this since the beginning of this pandemic, our community does a really good job of coming together. We always have. Everyone has been working on this since the beginning. I actually look for the mask campaign to go very, very well in our community. And I do know that it's not going so well in a lot of other places, but I do look for it to go really well in our community. We have a smart and a caring community, and I think that we will see it make a big difference. And that's going to help all of our businesses and everyone to open safely and to protect employees, as well as preventing community spread. So I'm very hopeful about it.
Speaking of protecting employees, we're at the time of year where we have people come in our homes. It's bug season, so we want our exterminator to come back. The air conditioner may need a tune-up before we kick it on. How safe is it if we put on a mask and they put on a mask to come in our home?
It's they're essential services, and you can definitely put on a mask, ask them. They'll already have a mask on, I'm sure, because I've had to have a couple into my home a couple of times during this as well. And, you wear the mask to protect them. They wear the mask to protect you. Everybody washes their hands, and you go about your business.
Last week, a couple of states, Georgia included, opened certain services they deemed essential services. When will we see the spike or the effect of those openings?
Well, that's an interesting way to put it. So in a sense, they are the experimental group. We're the control group. Those states who are following the science are the control groups. And the ones who are trying something outside of what is recommended is, in a sense, the experimental group. So what we are going to see within the next 14 days of opening is undoubtedly going to be a spike. I've seen some really unsettling pictures, of people that are like packed. They open I think it was a TJ Maxx. I saw some pictures of that, or different stores. They open up and people just, pack in there and not a mask to be seen. And I don't understand it, but they will see the effects of that. And when you do things like that that don't make any sense scientifically, or common sense for that matter right now, you're going to see spikes, and then you're going to see your whole program move backwards. With Champaign County, and I look for, everybody is on the same page, and we're just sort of methodically marching towards, getting things opened back up safely, and then that becoming how we do things moving forward until we have a vaccine. And I don't know why places would risk, having to go back into basically phase one. But I look for us to just, continually march through this, because I look for our community to really do a good job with this. And it literally is all up to the community. If the community does what we need to do, we will just keep moving up the steps to reopening, and hopefully not have to go back.
Our governor is one of the more aggressive governors in all of this, and I've actually been impressed with how he's handled this. He's going to get a lot of pressure, though, if he continues the shelter in place past May 31st. How do you feel about that if he does continue it?
Well, it's done regionally now, so it's based on metrics. So as we move toward that, again, testing is a problem in a lot of places. Less so here because of some local initiatives, but it's still a problem. I mean, we're not seeing widespread testing enough to know exactly what's happening. But what we're going to continue to look at in our community, which is what we've been looking at since the beginning, is what is the healthcare capacity? And we will just continue moving forward with this. And as things, as we get used to it and move a little further and a little further towards the new normal, I guess I'll say, we will continue to look at things like rates and mostly hospital and healthcare capacity, because that really is the key to that really is the key to saving lives during a pandemic. So we'll just keep looking at that.
You personally, Julie Pryde, as a person, not as head of CUPHD, if restaurants open, let's say June 15th, when will you personally feel comfortable going in and sitting in a restaurant 10, 15 feet from another table?
Well, I mean, as evidenced by my waistline, I am having no difficulty eating out a lot right now. Of course, I'm taking it back to my car and to my home, but I'm still doing a lot of restaurant food. But it's going to depend on things. I do believe in our community that when they do start reopening things, that it will be done in such a way that is safe. And there are a lot of ways to do things that are safe, and they're already looking into them. So it would be on a case by case, basis. But I will just have to see what the situation looks like, because not everything will be created equal in other places, but I do believe it will be here. So, as long as the staff is masked up and the people are sitting far away from each other, there's no reason that cannot be done safely.
As if we didn't have anything to worry about. Mosquito and tick seasons coming up. Can they transmit this disease? Well,
it's not believed that they can at this time, but you know what? I hesitate to even say that, because I might, get off of here and go get on the internet and find out, now they found out that it can be. There's some question about whether it can be sexually transmitted. There's all kinds of questions out there. So again, this virus is so new, and we're just still, they're still researching all aspects of it. So I don't know. I honestly don't know for sure. But my suggestion is going to be for the mosquitoes and ticks, the same as it is every year. Mosquitoes and ticks carry their own nasty things. If they don't carry COVID, they carry some scary and some potentially deadly things as well. So always we're going to be doing our information out there about ticks and mosquitoes and how to prevent yourself from being munched on by them.
If I got a notice in the mail that it's time for me to donate blood, is that safe to do right now?
It is. It is safe to do right now. I mean, you go in, you wear a mask, they wear a mask, and you know, obviously, when you donate blood, everything is in there is clean, and they are probably doing even more. Although they do a ton of cleaning, as you can imagine, anyway. But there should be no reason why you can't do that. I mean, they probably won't stand right next to you like they sometimes do for the whole time, but they will be there, and there should be no reason whatsoever why you cannot donate blood. In fact, it's important for blood donations to keep going during these times.
Wear it, don't share it. How do we find information about that?
Well, there is actually a website, wearitdon'tshareit.com, because there's a website for everything. So wearitdon'tshareit.com. Go in there and look around, find out what it's all about, and hopefully this is something that people in our community will embrace. And moving forward, I hope to see more and more and more masks. Because it really is the key. And I think that when you see that when you're out, it lets you know that your community really is a caring community, and that they're really concerned about getting our community to be able to open up safely and start to do the things that we can do. So
if you see somebody in a mask, it means I care about you. I'm protecting you from me, correct?
Or it means, like with me, when you see me in a mask, it usually means that I haven't been able to get in and get my mustache waxed during this time. But yes, no, that's exactly what it means. My mask protects you. Please wear a mask to protect me. And I am absolutely going to wear a mask out there to protect essential workers.
If we've ever needed a time to laugh or for humor, now is it. So thank you for providing that. I want to thank Urbana Mayor Diane Marlin, as well as UPTV. Jason Liggett, you're amazing. Thank you for editing these every week. Julie Pryde, I will send you a wax kit as soon as I can get Amazon to send me things, possibly, okay?
Yeah, and meanwhile, Jason can just keep fuzzing that out for the
And the 15 pounds, Jason, we've all gotten 15 pounds heavier since this started.
COVID-15.
All right, Julie Pryde, Administrator of Champaign-Urbana Public Health District, thank you so much for keeping us up to date.
Thank you all.